In talking about different aspects that we can actually use to resuscitate a patient, we've been looking at them, right? So the next one we should be talking about is what is known as a chest decompression. Chest decompression. So chest decompression is literal, like, okay, there's so much air, okay, or so much whatever, it could be fluid in the chest of this person, and I want to relieve the person of that pressure. So I might use a needle. Okay, so it's also known as needle thoracostomy. Of course, I'm using a needle to gain weight through the thoracic cavity, through the thorax, to thoracostomy. It's a life-saving emergency procedure. You are trying to relieve pressure from a tension pneumothorax. Do you understand? So this is a condition where air is trapped in the pleural space. Okay, well, it could be also, any fluid like blood, but most commonly air. Do you understand? So when is it needed? When there's tension pneumothorax, so air is trapped into the pleural space. Okay, just like I said, there could be fluid too. All right, chyle fluid, that's chylothorax, pneumothorax. So signs include if the person is finding it very difficult to breathe. All right, if you check the trachea and the trachea is what? Deviated. Absent breathing sounds on one side, jugular venous distension, hypotension and tachycardia, hyperresonance on percussion. All right, these are, you just have to just opt in to this. Okay, just relieve the pressure like that. Okay, because the pressure could have been what? Contracting a whole lot of respiratory system, components. So how is it done? Insertion is traditionally the second intercostal space at the mid-clavicular line. Okay, look at this. Okay, second intercostal space. This is the first one. This is the second one. All right. So this is the most practiced one. You understand? So newer guidelines favor the fifth intercostal space at the anterior axillary line due to better successes. So equipment, you have a 14G or 16G needle. It's about 8 centimeters long. Okay, antiseptic solutions also clean the area. When you clean the area, you insert the needle just above the rib to avoid injury to any of the nerve, artery or vein that passes just close to the rib. You understand? So listening for rush of air, okay, and all of that. You understand? So this is just how, risks and complication is it could cause injuries to the lungs if it is not done carefully, right? Or injuries to the diaphragm or injuries to abdominal organs, right? Sometimes bleeding and infection, or sometimes failure to decompress. That's if your needle is short. You understand? So that's just what this chest decompression, method in handling emergencies simply entails.